Our presentation simulates a process of collaboration across departments in a hospital setting to resolve an imaginary scenario of external conflict in the workplace. We focus on solving external conflict through a process of communication. We took a situation that is loosely based on something we have experienced in our own clinical sites.
So the situation is that spinal cord injury patients require unique techniques to safely transport them to imaging exam tables. There has been miscommunication between the SCI staff and the X-ray staff, and it has left the SCI patients vulnerable to injury during transfer. It is causing conflict between the two departments because both believe that the other is doing the job incorrectly.
The plan we developed is a communication strategy to implement a series of new protocols and documentation that will ensure proper transfer of spinal cord injury patients during imaging. These protocols and the accompanying documentation will create accountability and increase overall patient well-being. We are hoping that with the proper use of this protocol and everyone willing to be on the same page when it comes to spinal cord injury patients being transferred, that this will keep all staff satisfied with high levels of patient safety at the same time.
The new protocol will involve training for both the SCI staff and also for the X-ray department team. Training emphasis for the SCI staff will include how to position patients for common exams. For example, chest exams, abdomen exams, spinal work, hip or pelvis. With this training, we expect that they will be able to collaborate and to help position in a safe way when necessary. Training for the X-ray team will include extra safety precautions for moving SCI patients. It will include explanations for how and for why, where they need extra support, and as tips and tricks for acquiring images safely. By collaborating between both the SCI staff and the X-ray team, we hope we can get quality images with maximum patient safety.
So our plan will be to appoint a joint committee, which we are calling the Omega Strike Force Team. And that will include the SCI physicians, the SCI nursing staff manager, the nursing education manager, and the imaging department manager. This team will formulate appropriate transfer protocols and then communicate these to the staff. The plan will be implemented through email and in-person communication to staff, through annual training seminars, and through documentation of each patient transfer during imaging. The team will then work together to ensure mutual consensus.
The communication of our plan is separated into a couple different steps so that we can very effectively hit every part that we need to. So the first step is the initial communication through email to relevant staff that describes the problem that we're looking at and kind of is announcing the creation of the Omega Strike Force team to develop the new protocols. So the staff that we would be initially contacting with our ideas would be the spinal cord injury physicians and nurses, the imaging department managers and staff members, as well as the nursing education manager.
The second step of the communication in our plan is to email the relevant staff communicating the protocols that have been proposed by the Omega Strike Force team. This second email will include an attachment of a brochure summary of the new protocols. This will allow the staff to become initially familiar with the new techniques. The second email will announce the first mandatory training seminar for the staff, and as needed, we'll also send reminder emails in advance of the training seminars. 。
Okay, step 3 talks a little about what the training seminar will include. First, it will have a PowerPoint that is going to be done by the lead physician and the nursing educator. And that will be required for all staff during all shifts. So that's going to include day, evening, and overnight shifts. Then there will be hands-on practice with other coworkers. They will practice assisting with Hoyer lifts, multiple team lifts, slide board usage, and sit to stands. And finally, there will be documentation of completion for each staff member. The staff member will initial a paper at the training session, and then they will receive an email certificate upon completion.
The fourth step of our communication plan will be the spinal cord injury lead physician as well as the X-ray department manager will start to communicate twice monthly so that they can confirm implementation of the protocols in progress. And how they will do that is monthly, they'll be looking at the numbers of spinal cord injury patient exams and then comparing those to how many of those ended up with new injuries, specifically while being in the imaging department from transferring or miscommunication. It will be looking at, is the new protocol helping the X-ray staff and the spinal cord injury staff communicate more effectively, and where else can we improve?
The fifth step in communicating our plan involves a monthly email sent to all staff. So as the SCI physicians and the X-ray department manager have communicated to ensure progress, we'll have a monthly email sent to all staff in order to update them as we have developed patient safety. This monthly email may include updates in our goals as they develop. It may indicate how many injuries have occurred this month during transfer or how few we have been able to limit. It'll include an update of whether or not we are improving in our goals. And it may also include any updates or new useful ideas to the protocol. For example, if the SCI staff decides that one member needs to always be present during transfer, that may work its way into the email. Or if the X-ray staff decides that the use of a slide board is no longer helpful, then any adjustments to the protocols will be included in this monthly email.
So our timeline for this, overall, it would be 3 weeks for the OSFT to finalize and submit new protocols and 10 weeks to implement and assess effectiveness of the new protocols. In more detail, week 1, they're going to hold their first meeting and propose the new SCI imaging protocols. Week 2, they're going to finalize those protocols and then they're going to submit those to the hospital administration for approval. The 3rd week, each department will email their staff to announce the training and information. Week 5, all of the staff is going to complete the training and information sessions. Week 8, they will begin implementation of the new protocols on the floor. And then week 10, the OSFT will evaluate the initial efficacy of the new protocols.
The progress tracking will be mainly written reports by the Omega Strike Force team and by the department managers so that they're able to track the creation of new protocols as they're all coming about and they're finding new things that work. There will be a paperwork binder kept at the spinal cord nurses station so that they're able to track the implementation of all the new protocols. And then monthly, the spinal cord physicians reports to track, like they'll look at his reports to track the overall goal of preventing the injury to the spinal cord injury patients during transfer, during the imaging exam specifically.
The greatest potential variable to implementing the plan we've devised involves the commitment of each staff member to undergo the training and to follow the new transfer protocols. By documenting both the training sessions and the protocols followed during each exam, as we've discussed above, the impact of this variable should be greatly diminished.
by including affected personnel and communication strategies. Implementing and following protocols can lead to better collaboration between departments and ultimately eliminate conflict.
So in conclusion, we hope that implementing this new protocol will help all staff members work together and ultimately keep the patients safe.